As healthcare professionals, we are trained in assessment, which is a systematic approach to gathering and organizing client data into a coherent format. This information then provides the basis for clinical interventions. Assessments can focus on social history, medical history, family history, and they can also focus on a client's religious and spiritual history. Spiritual assessment is the process by which healthcare providers can identify a client's spiritual needs, practices, resources, and any barriers to using their spiritual strengths in their recovery and wellness. Spiritual assessment is focused on how a client's religious and spiritual beliefs and practices function as positive and helpful, or sometimes as a negative dysfunctional coping mechanism. The ESSOP interview you are learning in this course is systematic because it is structured so as to cover the critical areas of religious and spiritual functioning that can affect behavioral outcomes. These areas are represented by the letters in the ESSOP interview. The questions represented by these letters cover religious and spiritual strengths, involvement in organized religious groups, and problems. More about what each letter stands for is covered in the next video. My colleagues and I have validated 16 religious and spiritual competency skills in survey studies and published the research in peer-reviewed journals. Conducting a spiritual assessment is the foundational spiritual competency skill that opens the door to building a therapeutic alliance, which research has shown positively impacts outcome. The interview is designed to elicit and harness a client's religious and spiritual strengths in their recovery and wellness. In a controlled study, researchers found that spiritual assessment was well accepted by patients. And another survey of people receiving outpatient services found that mental health care service recipients were interested in spirituality and wanted to discuss this with their mental health care providers. And the patients who were administered a spiritual assessment had significantly better appointment attendance. Taking a spiritual history is best thought of as a clinical skill that requires training and practice, rather than as a set of questions that can be administered by recipe or rote. It requires empathic engagement with the client. The interview should be conducted in a comfortable, quiet, and confidential setting and using a gentle, unrushed approach. The ESSOP can be used at an initial intake or administered when religious and spiritual issues arise in a treatment session to gather more clinically relevant information. Christina Puchalski is recognized as a pioneer in the movement to bring spirituality into healthcare. Dr. Puchalski is a professor of medicine at George Washington University, where she has focused on religious and spiritual issues at the end of life. She developed a spiritual assessment interview that is now taught in most medical schools in the United States. However, her interview, called the FICA, is tailored for physicians, whereas the ESSOP interview, which we are learning here, is designed for mental health professionals. But the guidelines she developed for communicating with patients about religious and spiritual issues are relevant for the ESSOP. She lists 4 key principles for taking a spiritual history. First, consider spirituality as a potentially important component of every client's life, one that affects their quality of life and well-being. 2, respect a client's religious and spiritual beliefs. 3, be aware of your own beliefs so you don't impose your religious and spiritual beliefs on clients. 4. Make referrals to chaplains, spiritual directors, or community resources as appropriate. A lot more could be said about each of these points, and they are examined further in the course on ethical issues in spiritual assessment. She also lists 3 practices she does not recommend. 1. Do not prescribe religion to non-religious clients or coerce clients to adopt specific beliefs or practices. This requires acquiring self-knowledge regarding one's own beliefs, and self-knowledge is the focus of another course in this series on spiritual competency. 2. Do not force a spiritual history if a client expresses no interest. The screening questions in the ESSOP will enable you to make this determination. 3. Do not spiritually counsel clients. Some religious and spiritual issues are best addressed by referring to a spiritual teacher or religious professional. Now let's get an overview of the ESSOP Spiritual Assessment Interview.